Black History Month. Last week we had a great discussion on black love being so important to the black community. And this week we'll be continuing with black health. The health of black people is unique because our experiences as black people is unique, and it's something that we like to discuss. And just to give you I give you a preview of next week's program, we'll be having a conversation on black entrepreneurs. And then finally, pardon? Black inventors, black inventors. And the final Sabbath will be on black, black wealth, black money, right, right. So I like to invite Tiana Fenton to lead off and just to kind of introduce the program.
All right, good evening, everyone. So, as was mentioned before, we'll be talking about black health. I'm Tiana, as I'm sure everyone knows. We have Sister Peart here. If she wants to introduce herself, that'll be fantastic. Sister Peart, we have Brother Chad, and we have Sister Dawn. Is the PowerPoint up and running, or? No. Okay. So I wanted to begin by just asking a few questions. So what do you think determines your health? It can be 1 word, 2 words, 3 words, however you want to say. What do you think determines or makes you healthy? In the audience or on Zoom. You can unmute yourself. What makes you healthy? Don't shout all at once.
Lifestyle choices, access to good health care.
Okay, I hear lifestyle choices, access to health care. Anyone else? What makes you healthy? We have the way you eat. There's someone here said the way you eat. Anyone else? You're healthy if you're free of diseases, okay? Okay, mental health, how you think. So all of these things do encompass what makes you healthy and what makes you unhealthy. Okay, it's really hard because I don't have the PowerPoint. Okay, so we'll be moving on. I'll just be reading the questions. It's hard because you can't visually see them, but I would like you to have your thinking caps on and your listening ears. Okay, so African Americans have the highest mortality rate for which disease? Okay, so just again, this is just something that I want you all just to ponder. We'll just talk about it together, and then we'll have the PowerPoint for the rest of the questions. African Americans have the highest mortality rate or death rate for which disease compared to other racial and ethnic group? Anyone have any ideas without seeing anything? What do you guys think? The highest death rate for which disease? Okay, I heard cholesterol, cardiovascular, so heart disease. Anyone else? Diabetes. Anyone else have any guesses? High blood pressure. I hear high blood pressure. Okay, so I can tell you that no one got the correct answer. Is anyone surprised? Everyone's surprised? Sister Peart was going to guess cancer. So why didn't you say cancer, Sister Peart? Okay, so the correct answer is cancer. So African Americans have the highest death rate or mortality rate for cancer compared to whites, Hispanics, Asians, all other ethnic groups in America. And we're going to talk a little bit more about why that might be. So, and I think I have it here. Right, so that is something, having a little bit of a feedback. Okay, so I'm on the second slide. Thank you. Awesome. So those are the choices that I have. And so cancer is the correct choice, but a lot of people thought it were all the other ones. So that's a little bit interesting. Okay, so we're going to go to the next slide, and we're going to keep this going. So another question, what do you think the maternal mortality rate or the death rate is while giving birth for African American women is? So we have a few choices on the screen. So this is 30 per 100,000, 13 per 100,000, 41 per 100,000, or 55. Anyone what do you think the maternal mortality rate? So what is the rate of death of women giving birth is? 30. I hear 30. Anyone else? 75 isn't on the screen, but I hear 75. 55. Go back to the previous slide. The slide kind of jumped. Okay, this one. We see 55. Okay. So no one also guessed this correct answer. Oh, thank you. So no one guessed this correct answer. So the correct answer for this, okay, actually, we have the correct answer, and then I also have the answer for white women in America. So anyone want to guess what those two numbers are, the ones that are left? 41 and 13. So we have the maternal mortality rate for African American women is 41 as compared to 13 for white women in America. So it's a pretty big difference. And that is for, the 21st century, meaning like today, right? Okay, so we have two more. What is the percentage of African Americans in the United States that are uninsured? Okay, that do not have health insurance, specifically health insurance. Someone said 100%. 20%, someone said 20. We see 15%. Anyone on Zoom want to take a guess? We have 15%, 11%, 6%, and 20. What percentage of African Americans are uninsured in relation to health insurance? And also, can anyone guess what the number is for white Americans? So we see 6% for white Americans, and what is the number for African Americans? On Zoom, I heard someone say something. No? 20. Okay, so the correct answer is 11% for African Americans and 6%. So it's double. It's about double double the amount of African Americans are uninsured as compared to white Americans, right? Okay, last one. What is the average life expectancy for African Americans in today's life? Okay, we see 75. Anyone else take a gander? And also the number for white Americans is also here. Okay, so we have a guess for 81 for white Americans. Anyone else want to take a guess? You can also participate on Zoom. 79 for African Americans. Okay, everyone's kind of quiet on this one. Okay, so the correct answer, it is 75 for African Americans and 79 for white Americans. So the difference of about 4 years of life expectancy. So before we started, I did ask the question, what determines your health? Now, this looks very school because this is literally a slide from one of the lectures that I did for Introduction to Public Health for one of the classes that I did teach. So, yes.
So you have public health experience.
Okay, yes, I am a doctoral candidate for public health. I go to FIU. And so last semester was my first semester teaching Introduction to Public Health. So this is kind of what I talked about. So what determines your health? So the most important predictor of your health, we heard lifestyle choices, what you eat, all these things. Actually, the most important predictor is socioeconomic status, meaning income, occupation, and education. Those are the most important predictors of your health. So those in the lowest socioeconomic status, meaning like the lowest class, if you want to say, tend to have the highest mortality rates in America, and people in higher classes tend to be healthier, and they also tend to have healthier behaviors. So in America, minorities have poorer health status than white Americans. And that's all because of health disparities, which I have defined on the screen. So health disparities are differences that exist between race, ethnicity, gender, all these things. Today we're specifically looking at race, but it can also be due to age, like I said, socioeconomic status, location, all these things. So, don't want to be super, super long-winded. This is a graph that I thought was really interesting. Again, what determines your health? So this is a person, we have 100% of the person, and this is the percentage that is breaking down to be what determines how healthy they are. So we see 30% is what you do, right? Diet, exercise, smoking, which we don't do, drinking alcohol, all these things. 70% is everything else around you. So yes, you can be as healthy as you want to be, but sometimes it's not necessarily in your choice whether you're healthy or not, right? And that's what we're going to talk about today. So I want you to take a good look at this and think of it and apply it to your life. Why am I sick if you are sick, and how can we fix it? Which we'll talk about later. So that brings us to social determinants of health. Everything that determines your health, that's not necessarily, I don't want to say your fault, but necessarily in your control, I should say. So we're going to do something a little interactive. We'll see if I can brush up on my own public health knowledge, and everyone can help me as well. Someone give me an example of a disease, and we'll talk about it through the eyes of social determinants of health. Diabetes. Okay, so we're going to talk about diabetes. So we're going to talk about it in the eyes of you have diabetes. So we know that African Americans are at higher risk of diabetes, right? But why? Is it genetic? Probably not. So, as I mentioned before, socioeconomic status is the big determinant. So if you are typically, again, this is all generalized. There are exceptions to every rule. I will put that out there. But typically, if you are minority in America, there are things that have been set into place where you have lower education, meaning lower health literacy, not as far as education level. And if you don't have good education, then do you have a good job typically? Typically, yes or no?
No.
No. So if you don't have a good job, typically, do you get paid that well?
No.
No. And if you have a lower paying job, do you typically have health insurance through that job?
No.
No. So if you don't have health insurance, are you able to go to the doctor every year for a physical?
No.
So if you don't go to get that physical done, are you able to get screened for diabetes every year? No. So if you not get screened for diabetes every year, are you then aware that you have diabetes? No. So if you're not aware that you have diabetes, can you then get treated for diabetes? No. So that's because of economic status. So now let's go over to the other side where we talk about built environment. How can your built environment at all affect your diabetes? So again, if you're in a lower economic status, typically you live in a low-income neighborhood, right? And here, because of history, which we'll talk about later, those are, how can I say this? Those neighborhoods tend to have less green areas, less walkability areas. And that's just because of history and the way that things have been designed in this country. So if there are no parks near you, are you able to take a walk? You're able to take a walk? Okay, you can walk, but then those low-income areas did typically have higher violence. So if it's a higher violence area, how safe do you feel walking outside? Not safe. So if you don't feel safe walking outside, how likely are you to walk around your neighborhood? Not likely. So then you would typically go to parks, but there are not many parks there, right? So then you would have to then take a bus, drive. But again, low income, typically, again, there's exceptions to every rule. Typically, low income, having a car isn't as feasible. If you do have a car, you might share a car, things like that. So if you don't have a car, so also gym memberships. How expensive are gym memberships? You know, you can do $10, but that's if there's a Planet Fitness in your neighborhood. Where are Planet Fitnesses typically located? In nicer, higher income areas. So if you do have a gym that is, you know, it can be $10 and the other gyms are 20, 30, 40, 50, depending on which gym you go to. So that's another thing. And then we also have access to food. Okay, lower income neighborhoods, they have a lot of, like you said, McDonald's, so they have a lot of fast food places. They have a lot of fast foods at every corner, and that's what you see. A lot of liquor stores. Of course, we personally don't do that, but there are a lot of liquor stores. And if you do notice, there's a lot of convenience stores as compared to Publix's, and someone has their hand up on Zoom. Go ahead. Brother Lifer, go ahead. No? Okay. Lost my train of thought. Access to food. So then typically a convenience store. Oh, go ahead.
Hello?
Yes, we can hear you.
Sister Petra,
Mm-hmm.
Diana,
Yes.
I am so proud of you.
Thank you.
You know, I'm just here listening to you and watching your reaction to what you are saying, and I'm seeing how you are enjoying what you are doing. I want you to know that the church is proud of you, and you just continue doing what you're doing. And, you know, I'm just going to go ahead and just call you Dr. Petra.
Oh,
There you
wow.
go. Amen.
Okay?
Gi-
All right.
give me a year or two, but thank you so much. I appreciate it.
Okay.
So we have access to food, and then, like I was saying, grocery stores we have food deserts. That's a whole other thing. And then what's also going back, access to healthcare. Someone did mention that. I think it was Sister Dawn mentioned that on Zoom. So going back to the kind of job you have, do you have access to health insurance? Then that means, do you have access to healthcare, right? So do you go to the doctor? Did you know that there are some places, even in Broward County, that are medically underserved? And I think Margate is one of the medically underserved populations in Broward County, meaning that there are not enough doctors for the population that is here. So if you do live in certain neighborhoods or certain zip codes, you are considered medically underserved. So there are so many things that can then contribute to why you might have a certain disease like diabetes. And that's just one way we can do it. And this can be mapped out for many, many, many diseases, right? So I just wanted to take this time for people to think about just hearing, oh yes, Black people are higher risk for this, Black people are higher risk for that, doesn't necessarily mean, well, you know, I'm just genetically predisposed to it. It's a reason. And there are things that hopefully we can be done, and we will try to discuss in the time that we have been given. And I just want you guys to think about it in a little bit more of a wider scale. Again, social determinants of health. I'll go over it again. We have economics, meaning your employment, income, all these things. You have your built environment around you, housing, infrastructure. And then we have your education level, not just school, but health literacy is very, very important. Do you understand what the doctor is even saying to you if you go to the doctor? And then you have the social community that's around you. How safe do you feel in your neighborhood? Violence is a big, big, big thing. And people don't even connect violence to how healthy you are, right? And then you have access to healthcare. And in this model that I have here does also put food in there. Some models do not, but this one also puts how accessible is food in your neighborhood. How food secure are you? Like, do you know if you could even get food next week? That's another big thing. So just think about it all together. I know I went really, really fast. I do apologize. I also do talk fast. But if anyone has any questions, you can ask now. If not, I'll turn it over to the next person on Zoom in the audience. If anyone has any questions, this will be the time. You can ask any of our panelists here as well, not just me.
And did you also comment on community safety and social context and the healthcare systems?
Yes. So for, like I was saying, that the community, like I said, violence. That's also, if you do live in certain neighborhoods, if you don't want to go outside, then it's hard for you to exercise. You know, it's hard for you to do things like that. Also, again, this doesn't necessarily equate to diabetes, but certain neighborhoods have been known to have lead in their environment, and certain toxins is linked to diabetes. So if you live in certain neighborhoods that have a lot of toxins in the areas, you are more likely to have diabetes. Again, is that your fault? No, but it is environmental toxins have been linked to diabetes as well. And you said something else?
A question, Tiana.
Yes.
Why is it that it's easier for the white population to get medical benefit than the black people? Because you mentioned that the black people have a lower rate as opposed to the white folks.
Rates, like the insurance?
Insurance, yeah. Why is it so hard for the black person to get medical help as opposed to the white?
You want to take that?
I'm gonna address it in my presentation, Sister
Oh,
Tina.
Okay, all right, so we will get to that question. Thank you so much.
Right. Tiana,
Yes.
Dr. Black is online. See, ask if he has any comments.
And we have Dr. Black here as well. If he also wants to comment, ask questions, answer questions, he can also jump in at any time.
Oh yes, I'm definitely here listening
Yes.
diligently, for sure.
Any other questions? Are we gonna, Sister Dawn is next.
Yeah, Sister Dawn.
Okay, Sister Dawn, so if you want to just take over, you can. We can take the PowerPoint down, and we can jump over to Sister Dawn. Thank you.
I'm sharing my screen. I'm going to be sharing my screen. So let's try again. Share screen. All right, there's my screen. Sister Tiana, I can see your passion for what you do, and I commend you. I join with Elder Lifer in saying that I am very proud of you and the information that you're bringing to us. A wealth of information. All right, so my question that I'm answering is, how has the history of Black people in America led to disadvantages of obtaining health care? So, Elder Fenton, I'm going to be touching a little bit on the question that you asked, even though Sister T covered a lot of it already. But if we go back to the history of Blacks in America, the history of Blacks in America is that Blacks came from Africa in 1619, and then it continued for a long time. We have 12 million Africans coming by way of the transatlantic 90-day crossing. Now, slaves were prohibited from basic amenities, legal marriages, stable, secure families, proper education, and even access to health care. So from the beginning, African Americans were at a disadvantage. Keep that in mind. Then, African Americans, since arriving as slaves, have had the worst health care, worst health status, as was explained by Sister Tiana, and the worst health outcomes. Now, what makes that a perpetuating pattern? Many famous doctors, philosophers, and these people were not African Americans. So many famous doctors, philosophers, and scientists of each historical era have been involved in creating and perpetuating racial inferiority myths and stereotypes. And think about if we have people in high places who have racial biases, stereotypes regarding African American, and these are people who are making decisions about our health care. What effect can that have on the access to health care for African Americans? Very detrimental effect. So racial bias, I just got some information on some historical events and some historical ideas that were purported regarding African Americans and how it shapes our access to health care. For example, Samuel George Morton wrote a book in which he claimed that Black people, like me and you, had smaller skulls than white people, and thus we had smaller brains. And of course, if you think about that, it's saying that we're not the most intelligent people because our brains are smaller. And then 1861 to 1865, during the Civil War, soldiers in the Union Army. They were poorly staffed. Black soldiers would die from wounds that white soldiers would recover from. Why? Due to a lack of supplies and treatment. Blacks continued to be used in medical experiments without consent. And that was whether you were dead or whether we were alive. And in 1932, many of us know of the Tuskegee study, where the U.S. Public Health Service, so this was a federal situation, started a 40-year experiment looking at the natural history of untreated syphilis. Some 600 poor Black sharecroppers enrolled in the study. The participants involved 399 men with latent syphilis and 201 who didn't have the disease. And they were told that they were getting free medical care from the federal government. They were unaware that they had syphilis, which ensured that the government doctors could study the disease and the effect it had on the participants. And guess what? Even when treatment became available, they were not treated. So again, we see where biases were perpetuating the access to healthcare, and then Black people were being used as guinea pigs for a study that they did not even benefit from. How sad, right? Then this is so recent, as in 2016, half of 222 white medical students and residents surveyed at the University of Virginia believe that Blacks and whites were biologically different, according to a paper. So, based on their belief, we were biologically different, and so they believed that Blacks felt less pain than whites, and thus were more likely to suggest inappropriate medical treatment for Black patients. This is believed to be the first study linking racial bias to biology, racial perception of pain, and the accuracy of medical advice. So these students were thinking or believing that as Black people, we felt less pain, and so that definitely shaped how our medical care was designed. So of course, we see these racial biases definitely, and then just the history of slavery really put us in a position where even the access to healthcare and how our health is treated in the healthcare system is very different from that of our white counterparts. Now, we may ask, currently, what are the factors? Maybe I need to mute everybody and then do that, or ask you all to mute yourselves. Can you all mute yourselves, please, those who are not muted? Because we're getting a feedback. Please, thank you. So the American healthcare system is beset with inequalities that have a significant impact on people of color and other marginalized groups. And these inequalities create gaps in healthcare coverage, even access to services, and poor health outcomes among certain populations. All right, what are some of the barriers? And this will answer Elder Fenton's question. It is a known fact that African Americans have significantly lower household incomes than white households. So, Elder Fenton, you were asking, why do we have less access to insurance? To get insurance, we need money, right? African Americans tend to make less than whites for the same jobs, pointing to unequal pay as a contributing factor in the gap in household incomes. And even when taking into account similar educational levels, workers of color are consistently paid less than white workers. What about access to affordable insurance? So due to the financial constraints, Black in America are more likely to be uninsured than white Americans. And of course, to access healthcare, we need insurance. Then we also have where in terms of the Medicaid, there are some people who you fall into this coverage gap where it's like we don't make enough. We make more than too much that you don't have access to Medicaid, but we don't make enough that we can purchase our own health insurance. So guess what? We are still left uninsured. So that's another problem. And then we also have the ACA, the Affordable Care Act. But even that insurance, that kind of coverage, many of the plans are still way expensive than African Americans can afford. So we still have limitations in terms of affordability. All right, then, okay, I covered that already. Then even in terms of, if we think about our own life and the trajectory of our own life as African Americans or Afro-Caribbeans, in terms of immigration, I'm sure if I should ask, how many of us coming here as African Americans had access to healthcare maybe the first 5 years of coming into America? Not many of us, right? So think about that. Even in terms of us coming here as immigrants and settling down, Tiana spoke about the pre-screening that we need to do to have the knowledge whether or not we have or we're predisposed to certain diseases. If we don't have insurance as immigrants, we do not have access to those pre-screenings. So there you have it. That's going to affect our health trajectory. So that is something to keep in mind too, where immigrants, especially those who have not established stable jobs or legal statuses are usually uninsured, and that bars access to preventive screenings and basic medical, dental, and even mental health care. And finally, which is something that Tina touched on, due to residential segregation, majority of African Americans and Hispanics, people of color, are likely to lack hospitals and other healthcare providers. Therefore, place matters. When healthcare providers are located within majority African American communities, they tend to offer lower quality of healthcare, and that in and of itself also will have an impact on our access to quality healthcare. And that is the end of my presentation. I don't know if we have any questions
Or even any comments?
or comments. Yeah.
That apart from the disparity in wages, we have discovered that this generational poverty can go back to discrimination in housing practices, because we have seen that one of the greatest uh, way of generating wealth for most people, all Americans, is to own a home. And these practices where blacks were prevented from owning home and owning homes in certain areas prevented them from, obtaining equity. Most people in church today, the most money you have is in your home. And if you're preventing people from owning home, you're preventing them from acquiring equity, which means that their children won't be able to afford to go to colleges where they get better education and by so getting better jobs. So one of the great evil that has been done to African Americans was this evil practice of preventing them from owning homes, which would have increased their equity. I just also want to add, however, that sometimes, we talk about the disadvantage African Americans face, but I also believe that we have some things which we can change. I call them generational curses. For example, my parents used to love salt fish and salt shad and everything salt. I mean, we as Jamaicans, we love our stuff spicy and hot and saucy and salt in it. And I end up being that way. And because I cook the way my father and my mother cook, and my children learn to cook the same way, they're going to end up, using a lot of salt. And that's what I call a generational curse. We end up with these morbidities not because we are predisposed genetically, you said, but because culturally we just have this taste for saltness. When if we can, rearrange our minds and be intentional and decide not to use salt, we could extend our lives. And when our children see us practicing these things, we can break a generational curse. Thanks for that.
Yeah, and Sister Dawn.
Elder Fenton.
Yeah, so knowing to the fact that the odds against us as black people, what would be your advice to us to make a difference?
This is Tiana. I need your help because you're the expert in that field. Can you help me with that answer? Can you help me?
I think I could provide some help with that answer.
Thank you, Dr. Black.
And Chris, just to let you know, Sister Pate has the solution ready and waiting. But you could say what you're saying,
And she will piggyback on.
I'll just give a little tidbit just from personal experience. It's I would say that it starts with denial of self. I think that to piggyback off of what other peers said, um, there are a lot of batons that were handed down from generation to generation that is just normalized. And at the clinic, one thing that we try and do with our patients, because we serve in an underserved area, and we try and let them know a big one is smoking. Cigarettes are so deadly and they're so costly as well. And we try and provide measures to help them to quit and everything like that. And one aspect we try and bring up is the average pack of cigarettes, I would say, costs between $5 and $7. And if you smoke a pack a day, which most people do, it'll run you maybe about $150 a month, give or take. And a medication that we try to offer to help uh, the cravings that you get from smoking costs $100 a month. So we tell them, if you were to stop buying the packs of cigarettes and invest in the medication to help you quit, you'd be saving $50 a month in actuality, and you would be investing in your health. So some of these habits that are costly, we claim we don't have the money to go to the gym, buy salads, eat healthier, but if you really dissect your habits, you can trim the fat in a lot of ways that can, help you invest more in your health.
Amen. And there's someone on Zoom. Is it Kirk or Kiki? There's a hand that's raised. You can go ahead.
Hello. I'm not an American, I'm a Jamaican. But for the little I know, and I'm going to piggyback on what my brother said as well, and I think education is extremely important. We have to teach our people how to invest as well, and how to maintain priorities. For example, we find that for a lot of us as black people, what I learned and I've realized is that we are very flashy. We seem to spend our money more on clothing, the, the, the more temporal things, instead of trying to invest our money so we can at the same time look at future development and future improvement financially. So if we can teach our people to understand, instead of you buying a shoe for, and again, I'm not too sure the prices here, you're going to buy something for 100 US. Why not use that 100 US to invest in something else that will build you to make sure you're properly educated, or to invest so you can have more money for later on? Another thing I realized as the elder also spoke about this generational thing is that for most of us as black people, we have inherited some very negative cultures. And part of it has to do with how we eat, it has to do with how we think, how we communicate. And these are things I think as a church as well, because we are a church platform now, at the church now, I think we need to do much more. It is one thing to preach the gospel, but I think we need to also remember the part of the gospel we use a lot, which is our health message, and to take that health message to all black people. But guess what? Many of us, as the same persons who are in the church, we don't even accept that health message. So maybe more of us need to accept it so we can be able to teach it and point persons to understand. One, believe in yourself. Two, learn to invest. Three, education is very important. And just bear in mind that even though you may have got the start as the white persons, stop envying the white man. I think most of us will do that. Stop envying the white man and just start to understand that you can also achieve. Start where you are. The journey of 1,000 miles is at the beginning with the first step. Thank you.
Amen. Amen. Thank you. So just before I get into the solutions, someone else was to do the main diseases that affect Black Americans. And so I'm going to touch on that before we go into solutions. And I, too, want to say thank you, Tiana, and how proud I am. You know, I said to myself today, I should not be up here. I'm too old. This is AY. AY is for young people. So I'm glad we do have a representative here that really represented the youth very well today. Thank you, Tiana. So we won't look at all of the diseases, but we look at the major ones. Heart disease. In general, diseases of the heart are the #1 killer of Americans. So we remember what Sister Tiana said. She said, what was the #1 killer among Blacks? And what was that answer? Cancer. But heart disease is the #1 killer among Americans in general. However, while the rate of heart disease has been steadily decreasing among whites, so heart disease among whites is decreasing. Since the 1970s, the rates are not decreasing as sharply among African Americans. The data tells us that the issue isn't that more African Americans have heart disease. So we don't have, it's not like more Black Americans have heart disease, but that this group's chances of surviving a cardiovascular event aren't as high as in other populations. So it is basically a cardiovascular event means a stroke or a heart attack or an aneurysm. When we get those, our chance of survival is way less than a white person, mainly because of the same factors that we have already looked at. Access to healthcare. If you don't have insurance, it's very unlikely that you're going to get these surgeries that are very expensive that you need when you have these incidents. So this is one of the reasons why the most important thing for us as Blacks is prevention. The Affordable Care Act, which was passed by Congress in 2010, expanded access to health care to all Americans. It appears that this access improved cardiac care for African Americans, and I know Sister Dawn touched on that. And as she mentioned, it didn't solve the problem, but I must say it really gave access to a large number of poor Blacks that never had insurance. They had insurance for the very first time. High blood pressure is the next one, and that is one of the risk factors for heart disease. It's now also known as hypertension or the silent killer. 1 in 3 African Americans suffer from high blood pressure. High blood pressure is difficult to manage without adequate access to health care. African Americans are less likely to have blood pressure under control than non-Hispanic Caucasian Americans. The next one we look at is cancer, and as we saw, it was the #1 killer among Blacks. While cancer is the #2 killer for all races, African American men are 50% more likely than white men to get lung cancer, and more African American men experiences issues such as enlarged prostate and prostate cancer. And sadly, more African American males die from cancer than any other ethnic group. African American women under the age of 35 see breast cancer rates that are 2 times higher than Caucasian women. We look at diabetes. Diabetes, or high blood sugar, also is an area of concern for African Americans who are almost twice as likely to be diagnosed with disease as non-Hispanic whites. We look at stroke. Stroke is a vascular disease. It's those that affect our arteries and our veins. Stroke impact African Americans more than any other racial group and at a younger age. Sadly, they are twice as likely to die from a stroke as Caucasians and are more likely to become disabled. Cancer, we basically are touched on cancer already, and we look at HIV. In 2018, African American blacks accounted for 42% of new HIV diagnoses in the United States. Now, why we mention all of these? Because many of us right here in church can identify with some of these. And the more we bear these things in mind, the more likely, or we hope, that we will take heed to the warnings. So we're going to look at solutions. What can we all do? What can physicians do? When physicians are aware of these ethnic barriers, they can help to eliminate racial and ethnic healthcare disparities by encouraging diversity within the profession, right? So when physicians are aware of these disparities, they try to prescribe medications that are affordable to blacks. So you know someone don't have insurance, you're not going to prescribe a medication that is so expensive that they won't even be able to purchase. Physicians must learn to recognize racial and ethnic healthcare disparities and critically examine their own practice to ensure that inappropriate considerations do not affect clinical judgment. For example, what Sister Dawn said before, can you imagine if you're a doctor think that your brain is smaller than a white person's brain and you're not as smart as the white person, and so they don't have to treat it the same way? They don't, you know, so we have to make sure that the physicians that we are going to do not have these biases. Nurses, one of the most powerful things nurses can do to reduce health disparities is to advocate for their patients. This may include advocating for patients' rights, appropriate resources, interpreters, distress screening, or even cultural competence training in your workplace. Or political leaders. Sister Tiana touched on that a lot. When we look at our parks and everything that goes on in communities, we can take part. We can be a part of the decision making when we vote, right? So when we're going to vote, sometimes we say, okay, I'm Democrat. I'm always going to vote Democrat, and I'm just going to go into the box and I'm going to check off everything for everyone who is a Democrat. But you know, we really can't vote blindly because we need to look at candidates who are in your areas. What are they doing? What are their policies? Are they supporting policies that are going to promote things that will benefit blacks, that will benefit your community? So we have to look at these things as well. Now, our previous First Lady, Michelle Obama, and I'm not being political here, but I really do appreciate what she attempted to do with the Let's Move 33 program. I don't know if many of us are familiar with it, but it had 5 key pillars. Creating a healthy start in life for our children, from pregnancy through to early childhood. So from you are pregnant, ladies, you can start a healthy lifestyle, training that fetus until they are born and continuing throughout their childhood. Empowering parents and caregivers to make healthy choices for their families. Serving healthier foods in schools, and I know she had a lot of pushback on this, even from the very kids, because they removed sodas out of the dispensing machines. Yes, they weren't happy about that at all. They were serving fruits and vegetables in schools. Ensuring access to healthy, affordable food was the 4th one. And the 5th one was increasing physical activity, going for long walks, joining a gym. These were the things that she promoted. Now, one of the things I want to say is that if you remember that picture that Sister Tiana had up there with the percentage of factors that affect our health, and does anyone remember what was the percentage that we had total control over in terms of food and exercise? What was that percentage? 30%, right? So if we only have control over 30%, we are really at a disadvantage, because the other factors, we can impact them in our voting decisions and so on, but we don't have that great of a impact in terms of what we can do. So we are left with 30%. So we have to maximize this 30%, okay? How do we reverse this trend that is set against us? Preventing illnesses is much easier and less costly than treating it, and we have to really be convicted of this. Don't say, when I get it, then I'll do so and so. We want to encourage all Americans, black and white, regardless of race, to take ownership of their health by getting routine preventative health screenings like blood pressure, blood sugar, cholesterol checks, age-appropriate screenings like mammograms, and so on and so forth. So I want to look at some of the screenings that are recommended, and some of the years are not exact because there are different screening guidelines, and some physicians may choose one guideline over the other, but they are not usually far apart. Most of the time, there may be just a 1 or 2 year difference. For example, mammogram, it is recommended that by age 40, everyone should have a mammogram done yearly. And according to the U.S. Preventative Task Force, it's every 2 years. But most physicians choose the 1 year to have your mammogram done every year. And if you have a family history of breast cancer in your family, it's recommended that you get it done even earlier. Of course, we still look at the barriers again, insurance. But we as blacks, we have to find the different ways out there that are available. There are lots of ways out there. There are programs out there that offer free mammogram. Whenever we have church health fairs, you can be guaranteed that there are free mammograms being offered there. We need to utilize these. For men greater than 40 years, a PSA should be done every year. All of us know what a PSA is. And that's what we're talking about, again, in terms of educating. We should be aware of the different tests out there that we should be doing. Because, for example, in the doctor's office, doctors are humans, the nurses are humans. Sometimes they make mistakes. Sometimes you go in for your checkup, and then when you leave, you said, wait, they didn't even ask me so-and-so. Wait, he didn't order so-and-so. Because sometimes you really have to take your health in your own hands. You reach age 40 and you realize that your doctor haven't even done a PSA on you. You ask him, listen, I would like to get a PSA done. If you know the PSA test for prostate cancer, if you know that there are family members in your family that have a history of prostate cancer, you let them know, and then you can get this test done earlier. If you have insurance too, some insurance companies, they will not cover these screenings below the age that is recommended. But if you do have a family history, they will, and they don't even ask for proof. If you let your doctor know that, listen, someone in my family was diagnosed with cancer at age 30, it's a first of kin, the insurance company will cover it. Your colonoscopy, by age 50, everyone should at least have a colonoscopy, or there's a Cologuard or a sigmoidoscopy every 3 years. The FOBT stool card is also used. It is not very reliable, but it's the least expensive. And so when you don't have insurance, sometimes your doctor will recommend the stool card. If it's positive, then they will tell you definitely have to get a colonoscopy done. Or annual physical, right? Very important. Every year, you should go to the doctor once per year. Compliance with medication. Sometimes the doctor order medications, we don't want to take it. I have nothing against naturopathic, okay? But when your doctor order your medication, if you decide that you're going to do naturopathic and you're not going to take your medication, you need to let your doctor know. You need to let your doctor know what herbal medications you have chosen to take. as a substitute. If you have high blood pressure or diabetes and you decide that you're not going to take your medication, what do you think? Do you think you should be checking your blood pressure every day and checking your blood sugar every day? Yes, and I see this many times. People say, okay, I am not taking my blood pressure medication because it makes me feel so and so, or I don't believe in medication, I'm going to try naturopathic. So I said, okay, so how is it working? How is the naturopathic working? Is it lowering your blood pressure or your blood sugar? I don't know, because they are not checking. You cannot do that. You can't wait until you have a stroke or you go into a diabetic coma, then you let the doctor know, oh, I wasn't taking my medication. Elder Pierre touched on diet. Low fat, low salt, low sugar diet is what we recommend. And we know that among Americans, Caribbean people, as he mentioned, we like salt. We like a lot of grease. Sometimes you look at the ackee and saltfish, you see the oil running, floating on top. We have to really do something about that. We have to use healthy oil. So it's not like you can't have your ackee and saltfish, but you can't use unhealthy oils. And the healthier oils for frying is organic, unrefined coconut oil. The olive oil is best for sauteing, right? Because olive oil cannot withstand high heat. So you can't fry with olive oil. In fact, it will have the worst effect on your arteries. Okay, it will oxidate, and then that's not good for your arteries. Okay, and it's always best not to fry. So even though coconut oil is the best to fry, frying is not the best. Let us try to bake and broil and grill and steam, right? Instead. Consuming more fruits and vegetables. Previous studies have shown an inverse association between fruits and vegetables intake and chronic disease. So the more vegetables and fruits you intake is the less chronic diseases that you will develop. Okay? So let us, how we can encourage our family members, brethren, to eat healthier, to exercise, and do all these things that I have mentioned. Now, some of us on the line right here now on Zoom, on the conference line right here in church, maybe some of us are not directly impacted here, right? We may have insurance. Some of us are eating healthy. We're doing all the right things. We go to the doctor every year and we get all our screenings. But listen, we have family members, friends, co-workers who are not doing these things. And I really want to encourage us to ask them. Don't wait until it's too late. Ask your parents, Daddy, did you go get your annual physical? Follow up with them. Make sure they do get the annual physicals. Make sure they're getting the screenings done. And, you know, these are the things that will help us to fight against everything else that is set up against us, the 70% that is set up against us. All we have to work with is that 30%. Now, I think it was Brother Kiki or Kirk, the person that was on Zoom, mentioned how we can use our money wisely. And I'm a strong proponent of that, because I had a patient come in and she said she had not seen the doctor for 5 years. She doesn't, I asked her why. She said she doesn't have insurance. So I asked her, why is she here today? She's not feeling well. She's on a job that she works 7 days a week. It's a living job. She said it's very stressful and she didn't get time off to go to the doctor, so she hasn't gone for 5 years. She doesn't have insurance, so her visit was $120 for an annual examination. Then she had to do the different blood work that we recommended. She had to do a pap. Oh, did I mention the pap smear, right? So women should also have a pap smear every 3 to 5 years. It's 5 years if you do the pap with the HPV as well, then every 5 years, okay? So that was an oversight. Starting at age 21. You don't need to do it before age 21, and you no longer need to do it after age 65. So back to what I was saying, this young lady. So in all, her bill came up to $500 and something dollars. She was saying, oh, I don't have so much money. No, this lady's on a living job, 7 days a week, and she has been working for all these years and not taking time off. So I said to her, come on, divide the $500 by the 5 years that you have not gone to the doctor, and that's $100 a year. Don't you think that's reasonable to spend on yourself, $100 a year? Because she was going to leave without doing all the tests that we recommended. And so she said, you know, that's a good way to look at it, $100 a year. And she went along and she did her test. But when I looked at her purse, you know, I have an idea, you know, what the purses cost. You know, I look at the shoes and I look at the eardo, and I know all of that add up together. It's more than $500. So that is what that young man was saying. We need to prioritize our health. I know we have all these things stacked up against us, the cost of health care, the cost. But sometimes we don't set our priorities right. Instead of buying all that clothes and all that hairdo and everything else, let's spend the money on our health. One last thing I wanted to touch on. Do I have time? 5 minutes? We wanted to look at men's health, okay? Because I read a study that the CDC did. That's the Center of Disease Control. And what they're saying is that black men, do not go to the doctor as much as white men. They don't like going to the doctor. They're not following up with their annual physicals. They're not following up with their screenings. They're not compliant with their medications, blood pressure medications, especially. And a lot of it is due to different types of myths out there. Any of our males on the Zoom or the conference call, anyone of you can comment on this? Is this true? Do you know any males that have issues going to the doctor? And could you tell me any reasons why you think this could be? Anyone? Oh, Elder Edwards, sorry. Someone is on Zoom. Sorry, Elder Edwards, after this person on Zoom. Go ahead, Zoom. I can't make out the name. All right, Elder Edwards, what you were saying?
Can I say something?
No.
If you hear that you're gonna, if you don't go to the doctor, you won't hear that you're sick. So
Okay.
you stay home and you're better.
Okay, Elder Edwards.
Yeah, I have an employee that works along with me, and I was talking to him last week, and he says that when he gets up on Sunday mornings, he looks about a dozen eggs, for he and his son. So that means about 6 eggs for each person. I said to him, when last have you been to the doctor? He says he has never been to the doctor. So I have to encourage him. I said, you need to go to the doctor. You might feel that everything is okay, but you need to visit the doctor. So it is true that men, I wouldn't say men in general, because I go to the doctor like every 3 months. My doctor is right there. He can testify to that.
And then you see him every Sabbath too.
I see him every Sabbath. So it's true that men in general, they just don't like the doctor. But it's encouraging for us to do that.
Right. And what Elder Pierce said, it might sound like a joke, but it was actually listed as one of the reasons. Men, some men said they know what they're going to hear, and so they just don't go. And I'm wondering if sometimes healthcare providers beat up on the men when they go in there and say, oh, you shouldn't be doing that, you need to be doing that, and they feel so bad before they go that they don't even want to go. One of the other reasons that they found was that Black men on a whole, they do not trust non-Black doctors, right? And how many Black doctors do we have? I don't know why that distrust is there so much more among men, because many women see white doctors, white physicians. I personally prefer non-whites. I just think they understand us more, and they're able to, deal with us on a different level. Another reason it gave was men feel demasculated when they have to do certain tests and procedure. For example, I know you're not going to raise your hand, so it's a hypothetical question. How many males here have already done their annual PSA check with a urologist? That's a special doctor that deals with the prostate. That's a test that's very challenging because it's actually a rectal examination, and men just do not feel comfortable doing this test, but this test could save your lives, because sometimes when you do the PSA, the levels may come back elevated. When you go to see the urologist, he needs to do that exam. And so, this was one of the reasons that was given, that men, they feel demasculated when they go. I asked a male person and I said, why don't the men ask a female then to do the test? Would you feel more comfortable with a female? I don't know. I mean, a female urologists, there are out there, but because I know most of the urologists are men. It's the test in itself that's not a pleasant one. Okay, well, this is the end of my presentation. Dr. Black, do you have anything to say on this?
I want to piggyback on the financial aspect that you were talking about. I think it was just reported by MSNBC that in 2021, I think the black dollars, there was $1.7 trillion spent by the African and the Afro-American community. I believe we have the lowest percentage of ownership in the country, which is very disparaging. But it reveals to me that we do have the finances, and we can just find a way to really change our mentality and the priorities that we have. We can really make an impact for ourselves and our future generations. $1.7 trillion with a T. So that's quite a bit of money. It shows that wants, when it comes to our wants, we will find a way to get it done. So if we can translate that to our needs and really try and find a way to get it done. If that gym membership is $25 a month, just find a way to trim the fat. If you're used to eating out X amount of times a week, then decrease it by however much so that you can take that same money and invest it somewhere else in regards to your health. So we do have the finances. I'm a firm believer in that. We work hard, but we just have to find a way to move it around so that we don't have to bend over backwards to put our health first. We can move money around, move resources around, so that we can be here longer and show our children, our children's children, and our grandchildren's children that ourselves first. So yeah, in terms of the financial aspect,
Thank you, Chris. Thank you. And so I'm here to provide some closing remarks and then hand off to the Vespa voice. So I'd like to thank the panelists. Well, let me thank the audience first. I'd like to thank everyone who joined us today. And I hope that whatever you've learned today, you take into the community, into your workplace, into the space that you share with your family and your loved ones, and give good advice. in terms of health, because it seems as if education is something that we can use to change the reality that black people face in terms of healthcare. So I'd like to thank the audience. I'd like to thank the panelists. I'd like to thank Tiana, Sister Dawn, Sister Peart, and I'd like to make a special appeal. Margate SDA, we have a health ministry. Health Ministries Department, anyone who is interested, all of us here, we're involved in some way in healthcare. But even if you're not in healthcare, but you have an interest in health, feel free to join. We'll definitely use you to do a good work for the Lord. And there's an opportunity to use creativity to educate the church and the community on good health. So in terms of closing remarks, just to summarize, we've discussed the disparities that exist in the healthcare of black people. We've discussed the disadvantages and the obstacles faced by black people in staying healthy. And we only have 30% to manipulate and to modify. The 70% for the most part seems to be unmodifiable. And we essentially have to leave it to the Lord and just pray for changes to be made to the educational system, the built environment, things of that nature. But the 30% is modifiable. We discussed how black history has affected black health and the relationship between the two. We've also discussed the most common medical conditions impacting the black community, namely hypertension, diabetes, stroke, cancer. And we ended on solutions, potential solutions. So what I would advise is, for those of us who have health care, the two most common ways of obtaining health care in America is via Medicare for persons who qualify, and via employment through an employer. So for those of us who have health care, take advantage of the health care that you have access to. A lot of us, we're in jobs, but we're not going to see the doctor. We have health insurance, but we're not taking time off to see the physician. So use it up. Take a day off. Say, listen, I need to take a few days to see my primary care physician. For those of us who don't have insurance, try to get educated on healthcare. And I like to say that every third Sabbath at Margate SDA, we have a health talk, 10-minute health talk from the Health Ministries Department. And, Margate SDA is one of those churches that we are really interested in the health message. So for those of us who have friends who don't have health care, but they'd like to learn on how to take care of themselves, to maintain and enhance their own health, invite them to tune into the Margate SDA. And remember, New Start being an acronym for nutrition, exercise, water, sunlight, temperance, air, rest, and trusting God. That's a good guide for maintenance of health. And the Margate Media Ministry, that's something we've been playing around with. But even the tech team, we're thinking of ways to reach out to the community, Elder Edwards, in terms of ministering about Christ, maybe via social media, but it could be a good means of also educating on health and the health message. So that's something that the boss there in the background, Steph and Andre and all of us were thinking about. So stay tuned on that. So even though it's doom and gloom, there is still hope. The hope lies in education and ministry. So I think there's still hope to educate the black community on how to stay healthy. Stay healthy and how to become even more healthy. So I'd like to thank everyone who participated in today's program. I'd like to invite any questions or comments up until, and then at 6 o'clock, I'll end with a prayer and then hand off to the Vesper voice. But I think the sun sets at 6:10 this evening. So any thoughts or comments from anyone?
continuing to take all the aspects that are within your control.
Could you identify yourself? What? Oh, Vanessa, I'm joking. Vanessa, I'm joking. All right, go ahead. Go ahead.
Yes, good evening, everybody. This is Vanessa. Just to continue on the idea of taking whatever all those aspects that are within your control to continue to do so as best as possible. Even if you do have access to healthcare and you have access to health insurance, don't take it for granted that okay, you can afford to, pay for medication if you get sick or become hospitalized, because you don't want to cause any negative impact on your potential outcomes just by being, African American. I think maybe referred to this in terms of genetic predisposition for certain things, but just by being African American, sometimes even the treatment modalities for different conditions might be different because you're black. So, like, the doctor might have less options as far as drugs are concerned to work on you for a particular condition because of the fact that you're African American. So, continue to take whatever other factors you can take control of, like your diet and your exercise and so forth, into your hands as far as possible to aid the process.
Thank you, Mrs. Hines. Thank you.
And also,
right there.
Dr. Hines.
Yes, Elder Benton.
Sister Piet mentioned something, and I don't know if how they can go around getting some sort of coverage. Sister Piet mentioned that she will actually help the lady to understand that it's important that if you put it this way, $100 a month, as opposed to $500, she probably would not have done it. So Sister Piet did a wonderful job. So I'm wondering, in your presentation and every third Sabbath, because I do believe we have people among us who is unable to go to the doctor because of finance. So I don't know if you will be able to enlighten them in ways that they should not stay away from the doctor because of finance and what they could do, that they could make it for them.
Can I say something on that?
Can I add to that, please?
Sure.
Johnson. Also, I think Broad Health has a program where people who do not have insurance, once you're, you have your insurance or whatever it is, you can access, you can access a grant or a free program where you can get doctor per se, but you register and then they assess you and then you can get a grant to see the doctor on a regular basis.
Thank you so much. And Sister Pierre.
Also, okay.
Right? Moped.
Moped.
How is it spelled?
Moped, M-O-P-E-D.
M-O-P-E-D. Oh, thank you so much. Thank you, Sister.
Right. Right, 7th Avenue Clinic. Right. Right,
Oh,
right.
Thank you. Thank you so much.
Sister Brown. Exactly. 7th Avenue Clinic. It's always there. When for your first visit, they never charge you, but they do take your information and. After they assess you, if they realize that you're in a big job and you can pay, they will send you a bill. But at least you can do that. But also, because prevention is way less expensive, right? So if you can't get through at 7th Avenue, I'm telling you, for an annual physical, it's $110 to $120 for the year, brethren. Okay, so many of us here, we can afford that, $120 for annual physical. But of course, they're going to order some tests, like your lab work. Like for a CBC, it's $40. To do a chemistry, it's $40. If you do the two together, it's $70, So if you do this, your annual, it's not that expensive. Then you wait until you have the illnesses and then it gets more expensive. Of course, when it's time to do your colonoscopy and so on, those are definitely very expensive tests, So for those, you have to put aside some money. And once someone even suggested that we could put aside what we call a health savings account, because some of the insurances that we get on our jobs these days, the copay are so high, the excess, the deductible, so high that they themselves set aside what they call a health savings account, and they give us a card. So if you don't have insurance, you can personally set aside an account that you call a health savings account, and you put $50 in it every month, just in case you get very ill or you have to do a colonoscopy or any one of those kind of ultrasounds that's very expensive. You have that money set aside. Okay.
Yeah. Sister Edwards, you have something to say? Okay, thank you. And next Sabbath is going to be Black Inventors, and then the following Sabbath will be a Black Wealth. And I think there will be some good advice in terms of how to be financially secure, and it ties into health because money and medicine, they're connected. So I'd like to thank everyone for participating. I'd like to invite you all to join me in prayer. Dear Lord, we thank you for this program today. We thank you for everyone who participated on the panel today. We thank you for the information that was shared, and we pray that you put this information to good use to educate our community. Lord, please keep us healthy so that we could do your work until you come, Lord. All of these mercies we ask. In your precious name we pray. Amen. I'll hand over to the Vesper voice for this evening. Thank you.